Good morning, and thank you for joining PHSA's Return to the Workplace virtual conference. My name is Patricia Clausen, and I am the Director of Prevention, Engagement, and Retention for the government, municipal, and education sectors at PHSA. I'm pleased to welcome you to the presentation on general guidance, occupational health and safety for businesses returning to the workplace, and this is specific to the education sector. Before we begin, I just want to mention that there will be an opportunity for us to answer a few questions following the presentation, and I would just ask that you place your questions into the chat bar, and then we will select, as time permits, a few questions to answer at the end of the presentation. So at this time, I would like to introduce our featured speaker, Rob Oliver. Rob has been a health and safety professional in Ontario for over 25 years, primarily working in the government and education sectors. He currently works as a health and safety consultant with the Public Services Health and Safety Association, serving the education sector clients in Central and Eastern Ontario. Rob has achieved an honors science degree in kinesiology with a specialty in ergonomics and occupational biomechanics, as well as a master's degree in occupational hygiene. This educational foundation, combined with years of safety experience, has allowed him to successfully collaborate with employers and workers, addressing complex safety issues while ensuring worker safety and legislative compliance. During the COVID pandemic, Rob has been transitioning to distance learning as an instructor to various Ministry of Labor training, skills development, and PHSA courses, as well as assisting in the preparation of provincial health and safety guidance documents. This session will review education sector-specific occupational health and safety guidance, resources, hierarchy of control fundamentals, and highlighting best practices relative to COVID-19, infection prevention and control, and physical distancing. Welcome, Rob.
Thank you very much, Patricia. And I assume that you're able to hear me okay?
Yes.
Great, fantastic. Well, listen, welcome everybody, and I hope you're all settled in for the next half hour to 45 minutes. We're going to be discussing some of the general guidance information that has been prepared for Ontario's education sector, as we all begin thinking about our transition back to the workplace. One of the first things I just want to draw everybody's attention to is a resource that we currently have available on the PSHSA website, whereby, excuse me, just bear with me one second here. I'm just going to call this up for you. This is our website here, where we have links to a number of different resources specific to COVID-19 and the return to the workplace activities and efforts that are taking place in various sectors throughout the province. I'm just going to scroll down here a little bit, and you'll see that we have a number of different guidance documents for employers based on different sectors in the community and in the workplace that they're involved with. We have healthcare, municipal, public safety. Today, I'm going to be speaking to specifically the education and culture section documents that we currently have approved and online. The ones that you've just looked at here on the screen are all related to guidance for employers. And we also have a number of documents that are specific for workers in the same types of sectors. So healthcare, municipalities, and education culture, as well as public safety. And so these are the ones that we have now posted on our website. They have been approved by the Ministry of Labor Training and Skills Development. And those are the ones that I'm going to be referencing today. As the minister mentioned in his remarks earlier this morning, between PSHSA and the other safe workplace associations, there are currently are a total of 133 different guidance documents that are available through the Ministry of Labor Training Skills Development website that address various sectors throughout the province. Before I get started, I want to, speaking specifically about education, I want to make a couple of points. The first one being that even though we are in the midst of a global pandemic and uh, everyone is trying to actually do their best to manage and mitigate risk, it's important for us to understand as employers and as workers that the health and safety legislation in Ontario has not changed. It has not changed in terms of the responsibilities of different workplace parties, who's responsible for doing certain things, and so that's one of the reasons why I wanted to bring this slide in particular to your attention, because this is a slide that we use in a number of our different certification training programs. And essentially, the purpose of this illustration is to emphasize and reinforce the interrelatedness between the different workplace parties and their various assigned responsibilities under the Act. So, in dealing with a hazard or a risk such as the COVID-19, um, we need to look at that in a similar sense as we would with other hazards and risks that one may experience or be exposed to in the workplace. And so the underlying principle of or philosophy of health and safety legislation in Ontario is one where all workplace parties share the responsibility of safety in the workplace. And we refer to that as the internal responsibility system, where the employer, the supervisor, and the worker are all assigned specific responsibilities, with the end goal being that if everybody essentially does what they're supposed to do when it comes to their responsibilities, then we are really taking great steps and great strides to mitigate risk and to eliminate accident and injury and exposure in the workplace. And so when it comes to this triangle, this pyramid that we see, you'll notice that at the top of this pyramid, we have the employer, the directors of the corporation, the decision makers. Now, in an education context, that would be the Board of Education, the superintendents. We also deal obviously with libraries and museums in the education sector. And so in those areas, it would be the library board, or the CEO of a museum, et cetera, et cetera. And so at the higher ends or the higher levels of the decision making spectrum, there is the responsibility to essentially make sure that the entire organization complies with the act and the regulations. It's the employer's responsibility to establish and enforce health and safety standards for the workplace and to provide the resources for compliance. Now, in a COVID-19 situation, this is a case where this is a rapidly evolving situation in terms of our understanding of the disease, of spread, of transmission, of appropriate protective gear. And the important thing to recognize when we're looking at this internal responsibility system is that the general standard is one of reasonableness. Employers, in particular, have a legislative duty under Section 25(2)(h) of the Occupational Health and Safety Act to do everything reasonable in the circumstances for the protection of their workers. And as information changes and new uh, processes and procedures and things are demonstrated to be effective, what reasonableness means is likely to change over time. And so it's important that as we go into re-entering or reopening and returning to the workplace, that we are aware that because the situation is fluid, things may change and expectations of employers may change over time. The same goes with the supervisors as well. They have a similar type of responsibility. And so when it comes to the overall responsibilities, the employer ultimately is responsible for safety of workers in the workplace. Supervisors are there to essentially enforce whatever standards the employer has put in place. And the workers, their responsibility is to comply with the standards. And if they notice any hazards, things of that nature, they're to advise their supervisor. So I just wanted to make that clear that we want to put this into context that even though we're dealing with a very novel uh, virus pandemic situation, which essentially the world has never experienced before, the overriding legislation that relates to health and safety in the workplace has not changed. And that's irrespective of whether or not we're talking about education or healthcare or any other sector in the province. There are a number of different resources that we have that have been prepared that are available, uh, specifically related to the joint health and safety committees in your workplaces. So whether it be a museum or a child care center or a school board, a university, there is a particular checklist that has been put together for joint health and safety committees that is specific to the COVID-19 um, pandemic. And we also have information there on how we can maintain an effective joint health and safety committee during an emergency situation where some people may not be at the workplace, some may be working remotely, reduced hours and things of that nature. And so on the right hand side of your screen here, you'll this is essentially just a screenshot from one of our web pages that just lists some of the different reference materials that's available. It's free of charge. There are different posters and other information that is there that is intended to actually help during this transition as we return to the workplace. The next point that I wanted to cover has to do with how we try and control hazards. And again, irrespective of whether or not we're talking about a virus or we're talking about a working at heights hazard, noise, a slip and fall, there are certain principles that apply as we consider what needs to be put in place in order to properly address them. And what you'll see on your screen now is what we commonly refer to as the hierarchy of controls. And essentially, what this is referring to is the fact that when we are faced with a hazard or a risk in the workplace, the first thing we want to try and do is figure out how can we eliminate it? How can we get rid of the hazard? Because that obviously is the most effective way to deal with it. Now, in the situation of COVID-19, uh, we don't have the ability to completely eliminate it from all workplaces. However, we can by through things like either distance learning or working remotely, we can essentially eliminate the exposure by having somebody work in a different location. And so those are some of the principles that would go into determining what would work or what may be effective in your workplace. When we go down the hazard control priorities here, the next one would be substitution. The main controls that we're going to see related to returning to the workplace in this era of COVID relate to the following three control principles. Engineering controls, where we try and design out the hazard. An example there would be the plexiglass barriers or the physical shield separations that we see in places that we may go now. If anyone has gone out to a shopping grocery store, a big box store, anything like that, you'll notice that they may have put in clear shielding to essentially separate the employee from the client or the customer. That's an example of an engineering control. Other controls that we consider when we're looking at the COVID situation are administrative controls. We're going to alter our work policies and our work procedures. So we may have alternate days of the week where people need to be in the workplace, like physically at the work location, and then other times they may be allowed to be someplace else or working at home, those types of things. Administration also includes things like training and education on things that we can do ourselves to help mitigate the risks that we as individual employees may be exposed to. And then the final item on this hierarchy of controls relates to personal protective equipment. And that's something that you will have obviously seen and heard a lot of in the news lately over the last number of months. A lot of discussion about face coverings and gloves and things of that nature. And so those are also considerations that we need to throw into the pot when we're looking at a holistic view or approach to dealing with returning to the workplace in this era of COVID-19. Now, specifically, in terms of the education and culture employers and workers, there are a number of guidelines that are currently available on the PSHSA website. Now, this website is actually linked from the Ministry of Labor Training and Skills Development site. So if you were to click on, for example, the library guide for employers, on the ministry site, it would take you to this location here, and then you'd be able to download that particular document. And then the same with all of the other ones that you see on the screen here now. So they've been divided into guides for employers, and they've been and guides for workers. These are, again, I say, are the ones that are currently available online right now. And later on in my talk, I'll give you an idea of some of the ones that are currently in development that do not appear yet on this list. For the employer guides, the things that are included in the employer guides is information on how to protect yourself and your coworkers. So there's some general guidance there. The requirement to establish an occupational health and safety and infection prevention plan. So there needs to be some sort of a control plan in place in your workplace for how you're going to manage uh, workers coming back to the workplace, and how you're going to try and achieve some of these other objectives like physical distancing. What are you going to do when it comes to cleaning and disinfection of your area? And so there are guidelines or best practices in these guides related to things like environmental cleaning and disinfection. There's information in these guides related to reporting of illnesses, reporting requirements, um, making sure things are posted, how we are going to actually track and monitor what goes on in our workplace. And one of the most valuable things that you'll find in these guidelines is are the resources that are included at the end of each document, because these resources they provide internet links to the primary sources of the information. So, for example, Ontario Public Health. Or whoever it is that may be setting certain standards for your area. So if it's the Ministry of Education, if it's the Ministry of Labor, Training, Skills Development, there are links there. So if you were to go to those links at any time from now throughout the future, the idea is that you will be looking at current and up-to-date information, which, as I mentioned earlier, because this is such a fluid and dynamic situation we're trying to manage, it is extremely important that we are working from the best known current information that we have available to us. So that essentially just gives us a little bit of a snapshot into what we would see in one of the employer guides. Now, the worker guides has information, obviously, they have information on how to protect yourself and coworkers, how to recognize and assess different hazards, how to control the hazard, how to evaluate what's going on. The main thing really in the worker guides is the control piece. The control piece, there's going to be information there that reiterates workers' roles and responsibilities, what they need to do in terms of reporting hazards or concerns they have. There will be information in these guides on physical distancing, what personal protective equipment is required. There will be information on uh, best practices when it comes to things like the layout of the workplace, the physical layout of the workplace, desks, tables, spacing, all that kind of thing. And there'll be information in these guides on hand hygiene. So in the interest of time, with what we have with us this morning, it's not really practical to go through each of the 8 or 10 guidelines in detail that are currently available. But what I have tried to do in the next few slides is to pull out some information that is included in these guides and relate it back to what we talked about earlier related to the hierarchy of controls. And so the first one that I want to take a look at is the Child Care Center Employer Guide for those who run child care centers in the province. And one of the recommendations in this guide, the best practices information, is this symbol here represents an administrative control. And the comment is we need to have an infectious disease preparedness and response plan, and it needs to be based on information from the Ministry of Health and directives from Public Health in Ontario. And so the childcare centers, as well as a number of other employers, in fact, this isn't unique just for childcare centers, but as an example, there needs to be a plan in place for their organization, for their workplace, that is based on guidance, directives, and notes from the Ministry of Health and Public Health Ontario. Some of the other things that can be considered uh, relate to physical distancing. And I'm sure that if anyone in our group here today has young children or more than one children, the idea of trying to institute a system whereby uh, toddlers remain 6 feet apart from one another through the entire day may come to recognize that that is a virtually impossible task. What we're trying to do here is what is reasonable. We're trying to recommend what is reasonable in the circumstances. And so some of the ideas that we've included in this employer guide include things like physical distancing when it comes to nap mats, cots, cribs, the lunchroom for staff, things like that. Changing the layout of the workplace itself in terms of furniture, visual cues on the floor, things of that nature. People who come in and out of the workplace, physical screening, answer some questions, and that sort of thing. And then the availability of personal protective equipment for workers, face coverings, eye protection. Obviously, it includes hand sanitizing, things of that nature. So the physical distancing challenge is actually, we try and address that through three of the control principles: the engineering control, the administrative control, and the personal protective equipment. And when it comes to childcare centers, obviously cleaning, there are strict guidelines pre-pandemic related to cleaning of childcare, daycare centers, that sort of thing. And so enhanced cleaning ideas are also included in that particular guideline. Now that's an example of some of the information that you would find in an employer guide. In the worker guide related to childcare centers, we're considering a number of administrative controls here that that the workplace should think about, should consider. These are considered to be best practices: staggering and alternating lunch times, outdoor play time, more individual activities for children rather than group gatherings, restricting visitors and the workplace to only essential people, and cleaning, things like that. So these are things that the workplace should consider. So I put here under must. These are actually legislative requirements for when it comes to the worker's responsibilities. If a worker has a concern in Ontario about their health and safety or a risk in the workplace, they have a legal duty to advise their supervisor. It's not their duty to fix the problem, it's their duty to advise their supervisor so that action can be taken. Workers also have a legal duty to wear any personal protective equipment that their employer requires, including face coverings and eye protection. So In this particular education context, where we're talking about childcare centers, um, if the employer deems it reasonable and necessary to wear a face covering, then the employee is required to wear the face covering, as an example. Similarly, with libraries, the employer guide, again, it's talking about making sure we have a infectious disease response plan based on solid information from the Ministry of Health and Public Health Ontario. Some of the things that are suggested in this document related to libraries, suspending group activities, gatherings, um, reporting system to public health. Actually, that shouldn't be considered. I apologize. That actually is required. Um, this is actually a reportable condition to public health. Curbside checkouts materials, and then some of the engineering controls, plexiglass barriers, moving furniture around, et cetera, et cetera. For the workers, blocking off aisles, one-way aisle markings, rearranging public sit-stand workstations, ensuring physical distancing. And again, they have to bring safety concerns to their supervisor. And for the PPE, if the employer requires personal protective equipment, then it is the worker's duty to comply with that. These are the sections that are actually included in the one document that is currently available related to school boards in the province. And this is a guidance document that's related to temporary access to schools. Some of you, or maybe many of you, have been involved over the last couple of months of situations where individuals require access to the school, either to retrieve students' personal items or whatever the case may be. And so this document here provides best practice guidance for the boards, educators, principals, teachers, custodians, and things like that. The one I wanted to get to, the slide I wanted to highlight, is the one that you're seeing here now, where this this is a list of other education sector guides that are currently in development. And so we're in the process of working with the universities and colleges and Ministry of Education, Ministry of Labor, Training, Skills Development to finalize these guides related to universities, colleges, and school boards. And so there will be information similar to what I've just gone over in the library sector and things like that that would be included in these guidelines once they're finalized. And then when they are finalized, they'll be available through the Ministry of Labor Training Skills Development site. I would just like to point out that when it comes to illness reporting, uh, Section 52(2) of the Occupational Health and Safety Act is a section that requires if there is an occupational illness that someone believes arose in and out of the course of their employment at work, then it is reportable to the Ministry of Labor and WSIB. And also, this is the COVID virus is a reportable um, condition for the public health authorities as well. When it comes to reporting and different resources that are available, there are a number of guidance documents, again, that we've prepared in consultation with the ministries related to duty to report for workers and employers related specifically to COVID-19, illness reporting, illness reporting, and then some fast fact information as well. And so one of the things that we would like to do is through the chat function of this presentation is to include a number of links there that would take you directly to this information if that's something that you want to read up and learn more about. I just want to bring it to your attention right now that this information is available and it's really quite easy to access. One of the things that the minister mentioned this morning in his remarks was a return to the workplace readiness assessment, and this is something that again is available. It's online. It's free, and it is something that it should help you plan for your return to the workplace. Um, where we talked about the COVID guides that I just talked about, they're a fairly high level for entire sectors of the workplace. These return to workplace readiness assessment and the various roadmap that goes along with it, they're they're much more specific to outline procedures for your site at your workplace. So things to consider around the entrance, the exits, the washrooms, the lunchrooms, um, things like that. The readiness assessment is essentially 10 questions. It helps you to document your confidence relating to different factors that are tied to the return to the workplace. So there is a lot of information in there that is going to some questions that's going to prompt you to think and consider what other organizations are doing, consider what is reasonable in the circumstances, and what is necessary to do in order to make your best efforts to protect your clientele. It talks about screening, contact tracing, communicating information, things like that. That's all included in the readiness assessment. And then as well as the readiness assessment, there is a roadmap, which essentially is an action plan. It's a template that you can use to build your return to the workplace, your plan in 3 stages of recovery. It goes through the planning stage, implementation, and then finally the operational stage. It provides specific action items. It considers things like people, places, things, who's going to be responsible for what, timelines, when are things going to be done, status updates, and things like that. So this type of a roadmap you may find to be quite useful as you're planning for your return to your workplace. One of the final points I would just like to bring to your attention is that as we move through this together and we constantly learn, I've mentioned a couple of times that this situation is really quite fluid. um, Things are going to change. Standards are going to change. Guidelines are going to be updated. Directives from the province are going to be updated. What is considered to be reasonable and appropriate may even change. And so it's important for us as first of all, as citizens of the province, but also as workers of the province and employers of the province, to make sure that we try and remain as current with good information as we can as we move forward. And so one of the things that I encourage you to do is first of all to stop. I want you to consider what things are currently in place that shouldn't be. Are there things that you're doing that you don't really need to be doing that may be hindering you from doing something else? I want you to start what things, consider things that you could implement in the workplace that would make social or physical distancing easier for people, still by still being able to provide the services that you're providing. uh, and then continue. I want you to reflect and review what has been working and continue with that. Expand on it, build on it. Look to other areas, other employers similar to yours in the workplace to to find out what's working for them and see whether or not you can extrapolate that information and apply it at your own workplace. And one of the things that you can do, and what we're showing you here, is PSHSA, Public Services Health and Safety Association, our group. Um, we deal primarily, obviously, with public services. So we provide services to the education sector, government, healthcare, and first responders. And so if you fall within any of those groups, then feel free. You can go onto our website You just enter the first 3 characters of your postal code, and it'll tell you who the local consultant is in your area if you need any assistance with trying to stay up to date, or have any questions on what you may need to do to try and mitigate the risks even further. And with that, Patricia, I think that I will open it up now, and we will see if there are any questions.
Thank you, Rob, so much for the general guidance on the education sector. I'm sure it's been helpful for everybody that has joined us today. I have been monitoring the chat, have been responding in the chat bar to some of the
Okay.
the questions. One of the ones I think that I have seen patterning, which has been, asking about some of the reopening of schools when PHSA may have some of the guidance to support that. And I can share with you that we have been working closely with both the Ministry of Education and the Ministry of Labor, Training, Skills Development, and we anticipate that our guides will follow very either kind of in sync and aligned with the announcement that the ministries will be making and that have been shared by end of month. So we do work closely with the ministries, and timing of releasing kind of that information is aligned. So I would anticipate by end of month. So hopefully that helps. Just looking at the chat. Dave has posted the link to the Joint Health and Safety Committee inspection document from the PHSA website. So there was a question and ask if we could do that. So thank you, Dave, for including that in the chat, the link.
Okay.
And
Yep.
there's a question here on how others are restructuring the return to work planning. Do you have a committee leading the effort? Who is part of that is the committee involved, operations, HR. So that's really not directed for PHSA, but I'm happy to share that out. And if those that are in attendance could maybe provide some of your approach in the chat bar, that can certainly help Mimi Brown, who's asked the question. So just bringing that to everybody's attention. And there were some questions asking about if we'd be talking about childcare, which of course, as the presentation went on, Rob did share that information.
Yeah, and as I mentioned, both of those guides for employer and worker, they're currently available online.
And as I'm sure everybody is aware, the ministry did release some guidance for summer day camps as well. So you've got some really good resources out there if you're looking at running, youth programs this summer or childcare. So